Ulcerative colitis is a type of inflammatory bowel disease that causes inflammation, ulcers, and sores around the innermost lining of our intestines, like the colon and the rectum. This gastrointestinal disorder can be considered a chronic disease because symptoms usually develop over time or throughout our life course. About 1.4 million individuals in the US suffer from IBD. Here's an outline of my presentation. First, I will talk about the epidemiology of the disease. Then I'll talk about the cause of this disease in terms of deductibles and insurance premiums. Then I will briefly talk about the clinical characteristics and criteria for making diagnosis. Then I will briefly discuss the causes of ulcerative colitis. And after that, I will discuss the public health implications of this disease. And because of time constraint, I will not focus on tertiary prevention. And finally, I will just briefly discuss the primary and secondary prevention for this disease. The risks for ulcerative colitis are higher for those between ages 15 to 30 and those 60 and above. The risk for ulcerative colitis is also higher for whites and Ashkenazi Jews. Those with a family history of ulcerative colitis have a 30% higher risk of suffering from this disease. As you can see, this disease can be quite costly to some individuals who are being diagnosed. The deductibles are pretty high, and the insurance premiums are also quite high for individuals diagnosed with ulcerative colitis. These are the 4 common types of ulcerative colitis. Ulcerative proctitis is characterized by inflammation close to the anus or rectum. The signs for ulcerative proctitis include rectal bleeding. Proctosigmoiditis is characterized by inflammation around the rectum or the lower colon or sigmoid. The signs and symptoms for proctosigmoiditis include bloody diarrhea, abdominal cramps and pain, and tenesmus or inability to defecate despite urgency. Left side colitis is characterized by inflammation that extends from the rectum up until the sigmoid and the descending colon. This disease is characterized by bloody diarrhea, abdominal cramps and pain on the left side and an urgency to defecate. Pancolitis affects the entire colon, and the signs and symptoms for pancolitis include bloody and severe diarrhea, abdominal cramps and pain, fatigue, and significant weight loss. Ulcerative colitis are often diagnosed through stool sample to detect infection and parasites in the colon, or through blood tests for anemia or inflammation, or it can also be detected through flexible sigmoidoscopy that uses a banded tube with lights and camera to look at the lower parts of the colon, or it can also be detected using endoscopy or colonoscopy that scan the whole colon. And occasionally, ulcerative colitis can also be detected using X-ray or CT scans to show irregular ulceration. To this day, the exact cause of ulcerative colitis remains unknown. We know that ulcerative colitis can happen partly because our immune system malfunction. When that happens, our immune system attacks the cell in our digestive tract. This can lead to an inability of our immune system to fight off invading viruses and bacteria. Ulcerative colitis can also happen when the T cells has a cytotoxic effect on the epithelial cells in the colon. The abnormal immune response in our GI tract and the T cells having a cytotoxic effects in the colon can lead to the formation of ulcers in the colon. This subsequently results in ulcerative colitis. Ulcerative colitis can also happen because of genetic disposition or family histories. Diet and stress may also aggravate the formation of ulcers in our colon. And think about this, diet and stress depends to some degree on our family upbringing, our income, our residence or neighborhood, or our occupation, and whether this occupation comes with health coverage or not. Because I'm trained as a sociologist, the public health implications of ulcerative colitis can be understood through the fundamental cause theory. And this is a basic structure of the fundamental cause theory. According to this theory, our socio-economic characteristics like our education, income, occupation determines whether we have access to health protective and health enhancing resources. Our socio-economic characteristics also determines the quality of healthcare we are going to get. Our socio-economic resources determines the type of health insurance we have access to, including the reimbursement rates. Our socio-economic characteristics determines where we can or cannot afford to live. And where we live, our neighborhoods, our residents, can also serve as outlets for stress relief through the organizations we participate in these neighborhoods, like churches, book clubs, or the people we mingle with in these neighborhoods. And it's a no-brainer. The people we mingle in through our neighborhoods can serve as conduits for health knowledge. They can give us information about access to healthcare, quality food, nutritious food, avenues for stress relief, and so on and so forth. And our health knowledge or health literacy in turn determines our health behaviors or other lifestyle behaviors. This ultimately determines our health status and health conditions. In this case, we are talking about ulcerative colitis. Screening for ulcerative colitis in the form of stool sample, blood test, endoscopy or colonoscopy, or flexible sigmoidoscopy should begin from mid-adolescence because, as shown in the previous slide, ulcerative colitis is essentially bimodal. The risk peak between ages 15 to 30 and the risk peak again from age 60 and onwards. Ideally, all this screening and testing should be integrated with the primary care, and the primary preventive mechanisms should start from mid-adolescence, and it should focus on whites or Ashkenazi Jews, or those with family histories of ulcerative colitis. With respect to secondary prevention, attempts to increase affordability and accessibility for testing, diagnosis, and treatment should begin during mid-adolescence or young adulthood. This testing and screening can include stool-sample blood tests, flexible sigmoidoscopy, colonoscopy, X-ray, and so on and so forth. And treatment for ulcerative colitis can include medications to reduce inflammation and swelling, like mesalamine, sulfasalazine, balsalazine, osalazine. Treatment can also include medications or interventions to reduce stress. Treatment can also include hospitalization and surgery. Once again, priority should be given to those with a genetic predisposition or family history of ulcerative colitis. In other words, focus should be given to parents, siblings, or children of people suffering from ulcerative colitis. Priorities should also be given to whites and Ashkenazi Jews.